up here and ready. Good afternoon, and thank you for coming. I am Treney Tweedy, City of Lynchburg Mayor, and I'm joined at the podium today by Dr. Andy Mueller, President and CEO of Centra, and Dr. Carrie Gately, Health Director with the Virginia Department of Health. We are here today to speak to the Lynchburg community about the novel coronavirus, or COVID-19, and to reassure our citizens that the city and its partners are working collaboratively to prepare in the event that we should have cases here in this community. Just last week, our Department of Emergency Services convened a meeting with a number of those partners, including the Health Department, Centra, the Salvation Army, our institutions of higher learning, the Virginia Department of Emergency Management, Lynchburg Public Schools, and others to talk about COVID-19 and contingency planning. We have been closely monitoring the situation and have kept in close contact with one another to ensure we are prepared when and if we have individuals who test positive. In addition, the city's senior leadership is meeting on a regular basis to discuss continuity of operations and services to our citizens should the virus begin to impact our employees. Before Andy comes to the podium, I want to share with you a few of the decisions that have been made recently out of concern for both our employees and the community. These decisions were admittedly made out of an overabundance of caution. However, with the situation changing rapidly, our strategic management team believed it was the best approach to take. In order to reduce the opportunities for the spread of the infection, decisions have been made to cancel or postpone several events. Last week, we held the first class of our 17th Annual Citizens Academy. We have informed the students that we are canceling the remaining classes. We will also postpone the remaining Citizens Police Academy classes. The annual State of the City address scheduled for April 27th will be postponed for later in the year, as will the International Festival that was scheduled for May 2nd. Although I know this is disappointing, we believe it is more important for the health and wellness of our community at this time. Following guidelines from the Virginia Department of Health and the Centers for Disease Control and Prevention, we are also banning all business-related domestic and international travel for city employees until further notice, unless legally obligated by state or federal law. Again, we believe that these are important steps to take at this time, and I thank our team, I really do thank our team for providing the leadership and forethought necessary to keep our community and our employees safe. I also would like to recognize today, standing behind me are council members who are able to be present, our Vice Mayor, Mary Jane Dolan, Councilmember Wright, and Councilmember Perro, and thank you all for being here as well. We pledge to the citizens of Lynchburg to continue to work together as we do whenever we are faced with an emergency. So we all ask that you remain calm, prepare as you would for any challenge, and wash your hands. I understand that there is so much information on the news every night, and it can be somewhat unsettling and a little overwhelming. Please refer to the Virginia Department of Health or the Centers for Disease Control and Prevention websites for reliable, up-to-date information. What you just read on your friends' Facebook pages may not be true. Remember, in times of great challenges, we always work together, and we always get through the storm better together. So I will defer to Dr. Mueller. Thank you.
Thank you, Mary Tweedy. We really appreciate that. I'm Andy, and it's a pleasure to be with all of you this afternoon. And, you know, we've got presently 15 cases of confirmed COVID-19 in the state of Virginia. One of those is within the Centra footprint, but none of them are here in Lynchburg. None of those cases have been cared for in our Centra facilities yet. We don't know how big this is going to get, but we are certainly making lots of preparations to ensure that we're doing everything we can to be as prepared as we can. We, like we believe all of you should do, are not panicking, but really trying to be prepared and be prudent in these circumstances. So some of the things that we have done are certainly created a coronavirus task force, and we've also brought up our incident command center. So we have round-the-clock leadership constantly monitoring the situation to ensure we're ready for whatever this brings. We believe that we're at war with this virus, and we don't believe that's just us at Centra or the city or the Virginia Department of Public Health. We believe that's all of us are at war against this virus. And the good news is for the vast majority of our residents, this is going to be a fairly mild illness, but there is a reality that for many, this could be really, really serious. And so even if you're not somebody who's at risk, and even if you're not someone who is worried about contracting the virus, if you're not careful, you have the potential to spread it to people who may be at great risk. So we all have a responsibility to be careful and be thoughtful about how we're behaving in these times. So to that end, at Centra, we've also made decisions similar to what the mayor has described for the city. We've eliminated all travel, both domestic and international. We've also discouraged large gatherings in our facilities, so we've restricted meeting size to 40, because the reality is large congregations of people serve as a conduit for spreading this virus one person to the next. In addition to that, we are also practicing social distancing. And that's something that's hard to do because we're social creatures and we like each other. We want to show each other respect. But in times like this, intentionally not shaking someone's hand, or not giving them a hug, or not necessarily sitting as close to them as you normally would, is not being disrespectful. It's showing that you care about them because you want to make sure you're not transmitting virus to them. And so that's really important. So in addition to that, there are a couple of other things that are really important to know. So first and foremost, yes, we are up and running and testing for patients who are worried that they may have coronavirus. But the reality is, if you're not having symptoms, you don't need to be tested. That's not a good use of resources. And while more testing is available, we don't have unlimited testing available for every single person. The vast majority of patients, over 80% of the patients who develop COVID-19 are going to have a fever. Over 2/3 of them are also going to have a cough. So if you have a cough and a fever, call your doctor. Because while COVID-19 is growing in its presence throughout the country, the flu is still a lot more common. And it's possible that that may be what you have. So talk to your doctor and get some perspective on where you should then go to get evaluated. If you have those two conditions, a fever and a cough, and have also traveled to an area where there's a high concentration of COVID-19, and those would be countries like China, Italy, or locations in the United States like New York or Washington State, still talk to your physician. They may at that time direct you for testing, and at present we have testing available at our Forest Urgent Care. We too are employing the technique that many of you have seen on television with drive-through testing, just like it's been done in South Korea and Washington State. You may, when you show up for the testing, go through the same similar questionnaires, and if you don't really meet the criteria, you may be recommended not to have testing done. If you do meet the criteria, then we will perform testing, and we'll ask you to go back to your home if you're not acutely ill, and stay there until we get the results of the test back, which typically takes 3 days. If you are acutely ill, then we'll evaluate you and decide if you need more treatment than what we can provide on site. So those are some things to think about as you're worrying about, do I need to be tested or not? In addition to that, we really have an obligation and a duty to protect our patients, those in our hospitals and those in our skilled nursing facilities. So we've implemented some meaningful visitor restrictions that are not designed to harass anybody, but are really there to make sure that we're protecting our patients as well as our caregivers, who we're going to need in the upcoming weeks to be sure that we're ready to care for all of those who are in the community. So it's limited to healthy adults. So if you also have a fever and a cough, we ask that you not come visit our facilities. We're going to try to make sure that patients who do have those symptoms aren't going to be allowed in. We're also asking that anyone under 15 years of age also refrain from coming to the facility right now. And if someone shows up under that, we're going to ask them to leave. So we're going to continue to monitor the situation. We are absolutely going to partner with our city officials here in Lynchburg, as well as all the municipalities within our footprint, our state agencies, and the Virginia Department of Health in monitoring the situation. We're also working collaboratively with other hospitals in the state and region and following CDC guidelines with respect to treating this condition and monitoring this condition. So lots to happen there. So with that, I'm going to turn it over to Dr. Gately to talk a little bit about the Virginia Department of Health response.
Thank you. I'd like to begin by delivering my primary message, and it's the message, I don't know how many meetings I've had over the past 2 or 3 weeks, but it's the message that I try to get across in every meeting that I have, and also a message that I like to put out to the public as much as possible. It seems like a lot of times the only choice that we're being offered in how to respond to SARS-CoV-2, the virus that causes COVID-19, is either panic or do nothing. And we really have to reject those, that dichotomy as our only choice. What I like to say is don't panic, but don't ignore what's going on around you. Stay informed. And I'd like to really emphasize the word practice. Now, I used to say, don't panic, don't ignore, but, prepare. Well, I was finding that even that word was a little unsettling to people, preparedness and threat preparedness and all that sort of thing. So I decided to switch to practice. And what I mean by that is we know what to do as far as non-pharmacological interventions, personal hygiene. We really know what to do, or a lot of what we need to do as far as social distancing. We just need to start practicing it. And we've seen some examples here this afternoon. We know, for example, that the human hand, is an excellent vehicle for carrying all sorts of viruses and bacteria and infectious agents. And so we get tiresome, perhaps sometimes, in our emphasis on hand washing, proper hand washing, enough soap, enough time, scrubbing, so on and so forth. But it is important. Any infection control practitioner can tell you that it's important. Now is a good time to start practicing that when you don't necessarily need it this very moment. And so that's the message that we want to try to put out. It used to be we would say, sing the happy birthday song while you're washing. Try to get in a full 20 seconds and make sure that you're paying attention to all of your hands. That can get boring after a while, so some neat things have started appearing online, different songs that you can use. One of my wife's favorite is Karma Chameleon, for example. And so she'll be in there singing or humming that particular song while she's washing her hands. That's good practice, Make it fun. Think about it a bit. It was really enjoyable this evening to watch as we came in, us trying to figure out how to greet each other. I was going for, the elbow thing. Somebody else was going for the fist bump. And actually, I've been known to, do this while somebody is trying to fist bump or whatever. We'll work it out. With practice, we will work that sort of thing out. Cleaning of frequently touched surfaces is something that's very important. We may be not in the habit of watching those doorknobs, those phones, desks and surface areas like that. Now is a good time to practice doing better on those sorts of things. I'm glad to hear some of the things that the mayor's talked about today as far as social distancing at the community level. And I would like to add to what has been said already in the hospital setting and as far as the city goes. I'd like to issue an appeal to our churches, all those who assemble within the city. Again, not to panic or not to ignore what's going on, but this is a good time to think about what we're going to do as we start getting more cases and as this outbreak gets closer to home. What are we going to do as far as our Sunday assemblies? Can we assemble safely? If we do assemble, what social distancing measures can we put in place while we're together? Again, this virus loves a crowd. A crowd of people put in close together is very favorable environment for transmission of the virus. So, and the other thing, of course, that I think of is the virus is transmitted very often by people touching one another. And where do you want to see a whole lot of people hugging and touching? And that's church. And so it's something I think that we should think about now before we really have the need for it. And I could go on with that, and I won't. But I encourage everyone to look at all the recommendations that we have, look at the VDH and the CDC websites as have been referred to before, and think now, how could I implement that? How could I put this in place in my own home, in my business, in my church, and my social organization? We're happy to help. You may have to call a few times, frankly, to get through to us. My nurse epidemiologist, Haley Evans, is sitting in the audience. We were coming here from an hour-and-a-half long meeting with some other local governments, and she missed 27 calls in that time, but she will get back. She will get back to them. It's the same thing for me in my emails and my calls. It may take a while, but we will get back to you because we want to be your source of reliable information. Thank you.
Thank you. Thank you, Dr. Mueller. Thank you, Dr. Gately. I would also like to make note that Councilmember Nelson has come in to join us. So Councilmember Wilder and Hegelson were unable to join us at the last minute today. I want to recognize our city leadership as well. Our city manager, Ms. Bonnie Severchek, Deputy City Manager Reed Wodeka, Assistant to the City Manager John Hughes. Also, we have members of our strategic management team here, our Director of Emergency Services, Melissa Foster. We have our Fire Chief, Greg Wormser, our Police Chief, Ryan Zudema, Human Resource Manager, Michelle Jackson, our Communications and Marketing Director, Joanne Martin, our Office of Economic Development Director, Marjette Upshur, and Risk Manager, James Hall. We also are happy to have our Superintendent of Public Schools, Dr. Crystal Edwards, here with us, as well as our Regional Chamber, Megan Lucas, Executive Director here. And so we will now take a few questions. What I really want citizens to understand is that everyone is working collaboratively, working together, sharing information and meeting. And this is an evolving situation, it has been. And so as soon as we know what we know, we will share with our community. And so we will now take any questions you have. Yes.
Is the city asking churches not to hold services over the weekend? I also wanted to ask about Liberty's convocation on Friday. Thousands of students are scheduled to convene at the Lion Center. Should that occur?
We're asking everyone to practice precaution. And so what that means for their community, Dr. Gately has explained it very well. I can't add to or take away from anything he said. I think all of our community organizations have to think about the safety of everyone that comes into their fold. And so what that means for them, we hope they will understand, all community organizations and practice, especially in this near time right now where we are, practice safety and prevention and have precaution where necessary. Mm-hmm. Yes.
If there is a local positive case of coronavirus, what steps will the city and various departments do at that point?
I will probably turn to the city manager because the city manager is the one to implement any policies or practice changes in talking in cooperation with council members. But it is the city manager that makes all of the ultimate decisions and defer, again, to what Dr. Mueller said and Dr. Gately as well. So, thank you.
So clearly we will respond responsibly, and we will deal with the situations as they arise. We are here to serve the public, and that is what we are going to continue to do. We are going to get information out to our citizens in a much more robust way regarding alternative ways of paying bills rather than coming to City Hall. Perhaps they can drop them in the mail, or we're working through a lot of those kinds of things, but it is all going to be very situational.
My question is for Dr. Mueller. I noticed at Centra today there are some changes outside. There's a tent set up, there's other things. Can you just inform the public what are these things happening and what's happening at Centra?
Yeah, absolutely. Well, mentioned a couple of them. So internally, what you can't see is we've really stood up our leadership team to be prepared and in touch with city, state, local, federal officials around response to the vaccine. What you're seeing in front of the hospital is a tent that's similar to what we've established at our Forest Urgent Care. And that's going to provide us another testing site in the future if we need it. We don't know that we need it today, but in the event that we do, we're going to be ready for that. And if we need to stand up more specialized testing locations across our footprint, then we're going to be prepared to do that as well.
Dr. Holt, can I also ask if you could elaborate on testing? Would you
Yeah.
able to share with us how many testing kits you have available? If that's coming
Yeah,
from
so-
have or private?
So presently, we are utilizing one of the commercially available tests. There's more availability of those. The downside is they take a little bit longer to process than the state kits. We're trying to be respectful of the state kits and using those only if we feel that we really absolutely need to under certain circumstances. So they are available. Again, we want to test prudently and smartly. So once again, if you don't have symptoms, you don't need to be tested. If you do have that criteria of symptoms of a fever, a cough, and have been traveling to an area or have a known contact with somebody who's ultimately been diagnosed with COVID-19, then it really makes sense to be tested.
Can you tell us how many test kits you have available?
No, that's sort of a difficult question to answer because on the commercial side, it's really not a kit. We use a typical viral medium like we do in our clinics for other things, and we simply submit it for that specific reason to be tested for COVID-19. So it's really not a resource issue in terms of a kit, but at the same time too, there are a limited number of viral plates available, and those have to be sent off. And so we want to be prudent with that. But right now we have plenty available for testing. You bet.
I have a question for Mayor Tweedy. We have 5 colleges and universities in Lynchburg, and some have made decisions this week to postpone or extend their spring break and hold classes online. Others have not made that announcement yet. Some have expressed concern in the community about the idea of college students leaving our community and then coming back, possibly traveling to places where there is a larger concentration of coronavirus cases. Do you have any concerns as the mayor of the city about that? Do you have any concerns or share the concerns of those who have said that they're worried about these college students leaving to go on spring break and then coming back to our community and possibly bringing coronavirus here?
Right. I think we're not an isolated community. Yes, we have college students, but college students are not the only persons in our community traveling. And so there are people throughout our community for business reasons that are traveling outside of our city, family that have family in other places that are still traveling outside, in and out of our city. So we are still a city that's open for business. But I think the landscape and the environment for everyone evolves, as we said, daily. It's changing. And so this is a new experience for everyone. And so I would just ask everyone to remain calm and to understand that we are all here together, and it's not just one group that's coming or going. We have citizens throughout our city that are, and so we are all learning the new norm of how to practice the precaution and how to work together and how to communicate on decisions that are made at each of the campuses. I appreciate all of the campuses that have communicated with our city staff or sent us emails so that we do know what is occurring for their students. But when students are here, they are a part of Lynchburg. And so we want everyone to know that it's not just a particular group that's coming in and out. We have to practice the safety and the precaution that the doctors have said throughout for everyone. And so I just ask citizens to maintain that at the forefront. Any other questions? All right. Well, I want to thank everyone. Oh, yes. Mm-hmm.
A question for Dr. Gately. Coronavirus is obviously, COVID-19 is new for everyone, and there's a lot of unknowns. But in your professional opinion, can you give any kind of estimate as to how long this might last, when we might see a peak and then a dip? Do you have any information about that? I'm asking in reference to, some events have been canceled, and later down in the calendar, there's Get Downtown, there's other events. Would we have to look at canceling those in the future as well?
Well, I wish I knew what it was going to do. There are 2 broad scenarios that I have in mind right now. And the first one is that perhaps SARS-CoV-2 follows the same pattern that we see with seasonal flu. And we know that we have a flu season every year. It's generally during the winter months. And in various years, we'll see a peak of cases of influenza, February, sometimes early as January, February, March, or a little bit later. But definitely by the time temperatures warm up and we get into the summer, we see a drop-off in flu cases. Now, flu can still be transmitted even here year-round, but definitely a low number of cases as the weather changes. And so I have some expectation, perhaps, that the coronavirus will follow that same trend, follow that same pattern. If so, then we should see a drop-off in cases as the weather warms up and as we get into spring, late spring, and summer. And if that is happening and we're seeing a drop in the number of cases that we're diagnosing and generally getting the idea, not only here but across the world, then that is what is happening, then so much the better, and we might be able to start gathering again and resume our normal lifestyles. However, the unfortunate aspect of that scenario is that it is quite possible, if it happens, then the coronavirus will be back next winter when the weather cools off again, just like the flu does, except that it may have mutated and may be worse. So there's the positive and the negative of that. I have read other infectious disease specialists that I respect who are thinking that might not happen, and we might be dealing with this issue for several more months. An outside estimate I've seen from one individual is 6 months. So right now we do not know, I think, which of those scenarios or some other scenario I haven't mentioned it's going to follow. I think as far as making the decisions on how long we're going to continue these community measures and personal measures, personally, several of our non-pharmacological interventions for individuals, good hand washing, I recommend forever. Some of these things we should just always have been doing and should always continue doing. But as far as meetings, social distancing, and that sort of thing, I think we're just going to have to reassess probably on a week-by-week or month-by-month basis.
Any further questions? All right, well, I thank you all for coming, and remember, wash your hands. Social distancing is a new term, especially, and I don't know about my council members, but politicians, that's hard. We handshake and we hug and we kind of, greet each other warmly and everyone, our citizens, but please practice everything that the doctors have told you to do. Thank you very much. Thank you. We will be stronger together. Thank you.